So today we'll discuss about the anatomy of the hip joint. Type of the joint is synovial and variety of the joint is ball and socket joint. Articular surfaces of hip joints are here you can see this is hip joint. Here this is margin of acetabulum, and here is this is neck, and this is the head of the femur. If disarticulate this joint, you can see here this is head of the femur, this is neck of the femur, and here on the tip of this head there is fovea. This is known as fovea capitis. This is fovea capitis. This is a small depression present on the head of the femur. This is known as fovea capitis. This is lateral articular surface, that is head of the femur. This is head of the femur. In this diagram, this is head, this is fovea capitis, this is neck of the femur, this is greater trochanter, this is greater trochanter, here is lesser trochanter, this is lesser trochanter, this is lesser trochanter, and here is a line known as intertrochanteric line. This is intertrochanteric line. Intertrochanteric line. This line is intertrochanteric line. Medial articular surface is formed by acetabulum, medial side, this is margin of acetabulum, this is medial articular surface. It has lunate articular surface. This surface is lunate articular surface. Lunate articular surface. This surface is horseshoe shaped. This is horseshoe shaped. This surface is lunate articular surface. And here is a fossa. This is known as acetabular fossa. Acetabular fossa. And here is a notch. This is a notch. This is a notch. This notch is known as acetabular notch. This is acetabular notch. So this is lateral articular surface, which is formed by head of the femur, which has a fovea. This is medial articular surface formed by acetabulum, which has lunate articular surface, this horseshoe-shaped lunate articular surface. Here is a depression known as acetabular fossa, and here is a notch known as acetabular notch. So articular surface, this is articular surface. So both this and this articular surfaces are covered by hyaline cartilage. So these surfaces are covered by hyaline cartilage. You can see this is covered by a cartilage known as hyaline. This is hyaline cartilage. This also here is covered by hyaline cartilage. Here, this fovea is not covered by hyaline cartilage. This portion is uncovered. This is not covered by hyaline cartilage. Here, this acetabular fossa is not covered by hyaline cartilage. Acetabular notch is not covered by hyaline cartilage. If you articulate this acetabulum here, you will find it will be like this. In this diagram, this articular surface from here to here, this is sectional view, from here to here, this portion is here. This is lunate articular surface, and this depression, this acetabular fossa is this part. This is acetabular fossa here, and here a notch is present. This is notch. Here is a notch. This is gap. This portion is acetabular fossa, and here notch is present. Again, this articular surface is covered by here hyaline cartilage. This is hyaline cartilage. This cartilage is hyaline cartilage. Now, another important thing. Now, ligaments related to this joint. First of all, transverse acetabular ligament. Here you can see here transverse acetabular ligament. This ligament is transverse acetabular ligament, which bridge the acetabular notch. This is transverse acetabular ligament. Transverse acetabular ligament. Here in this diagram, you can see here it is present in this portion. This is transverse acetabular ligament. Transverse acetabular ligament. And that thing. And the ligament that is acetabular labrum. This is acetabular labrum. This is acetabular labrum. It is fibrocartilaginous rim attached with the margin of lunate articular surface. It is attached with transverse acetabular ligament, transverse acetabular ligament. So attached with the margin of acetabulum. Here, this portion is lies here and here. This is transverse acetabular ligament. Transverse acetabular ligament, and this is acetabular labrum. This is acetabular labrum, this is transverse acetabular ligament. So acetabular labrum, it holds head in position. Another thing, another ligament is a triangular shaped. It is triangular shaped like this. It is like this. This is triangular in shape and attached with transverse acetabular ligament. It has apex. This is apex. This is base. This is apex. This is base. Apex is attached with this. Apex is attached with fovea capitis. Here. This apex is attached with the fovea capitis here, and this base is attached with transverse acetabular ligament. This is triangular in shape. And the structure passes here deep to this transverse acetabular ligament, that is acetabular artery and nerve, artery, vein and nerve. It passes through this ligament and gives supply to about 1/5 part of this head. This is acetabular branch of medial circumflex femoral artery. So it gives supply to here. And it is another branch which arises from obturator artery. It also gives supply to this. It passes through this. Here is a fatty tissue is present. In this bursa, fat is present. So this ligament, this triangular shaped ligament, is known as ligament of head of femur, also known as a round ligament. This ligament is also known as a round ligament. It is also known as ligamentum teres. Ligamentum teres. So this is ligament of head of the femur. It has apex which is attached with this fovea capitis and base which is attached with the transverse acetabular ligament. And the ligament is capsular ligament. Capsular ligament attached with the margin of this labrum, acetabular labrum. The margin of acetabular labrum. Here you can see, here is a margin of acetabular labrum. So capsular ligament attached with the margin of acetabular labrum medially and laterally. Laterally it attached with intertrochanteric line. This is intertrochanteric line on anterior surface, and posteriorly, if you see on posterior side, you will find This is posterior surface. This is greater trochanter, this is lesser trochanter. This is intertrochanteric crest. This is crest known as intertrochanteric crest. Posteriorly, this capsular ligament is attached with neck of the femur about 1 centimeter medial to intertrochanteric crest here. So posteriorly capsule is attached like this, about 1 centimeter medial to intertrochanteric crest. So anteriorly it attached with the intertrochanteric line, and posteriorly 1 centimeter medial to intertrochanteric crest. This capsular ligament has two parts. Outer part, which has fibers longitudinally arranged, and inner part, circular part. Circular part is known as zona orbicularis. Zona articularis, this inner part is zona articularis. This is outer part that is longitudinally arranged. This outer part on anterior superior side reflects on the neck and forms retinacula. These are more prominent on anterior superior part. This forms the retinaculum. This is retinaculum. This is retinaculum. This retinaculum, which reflected on the neck of the femur, is extension of this superficial fibers which are longitudinally arranged, reflects from the lateral attachment to the neck. Acetabular vessels passes between these retinaculum and gives supply to neck and most part of the head. That means part of head other than which is supplied by the acetabular branch. So this portion and this portion is supplied by the retinacular branches. This retinacular branches arises from ascending branch of the medial circumflex femoral and ascending branch of the lateral circumflex femoral, superior gluteal and inferior gluteal join to form a circle around this. Here is femoral artery, this is lateral, and this is medial circumflex femoral. This medial circumflex femoral gives ascending branch, lateral circumflex femoral gives ascending branch. These branches form a circle around the neck, and these retinacular branches arise from this articular circle, give supply to the neck and most part of the head. About a small part which is supplied by this, like here. So this is capsular ligament, which has outer longitudinal fibers which reflect on the neck and form the retinaculum, and inner circular fibers. Inner fibers are circularly arranged. These are known as zona articularis. Here, circular fiber, outer longitudinal fibers. Here, inner circular fibers, outer longitudinal fibers. So this is capsular ligament. This capsule is internally lined by synovial membrane. So here you can see synovial membrane which covers the capsule like this here, and it also covers this acetabular labrum, This is lining of the capsule. Lining of the capsule, which is internally lined by synovial membrane. This is synovial membrane. Synovial membrane also covers this round ligament, and also it covers this fossa. So this is synovial membrane, which covers the intracapsular part of neck, inner surface of the capsule. Here also it covers some portion of the acetabular labrum, here and here. Also it covers the round ligament and it covers the acetabular fossa. So this is synovial membrane. Synovial membrane anteriorly, sometimes it comes out, a small portion of it comes out, it forms the bursa, known as psoas bursa. Here, iliacus and psoas, iliopsoas tendon, which takes origin from iliacus takes origin from here. Here is position of iliopsoas tendon. Here, so it lies, this bursa, psoas bursa, lies between psoas tendon, iliopsoas tendon, and this capsule of the joint. Between joint and this iliopsoas tendon, there is a bursa known as psoas bursa. Another important thing, and the ligaments which support the joint, anteriorly these ligaments are iliofemoral ligament. Medial end, it is Y-shaped, inverted Y-shaped, like this. So medially attached with the anterior inferior iliac spine. This part is anterior inferior iliac spine, this portion. So anteriorly attached with this, and laterally it attached with intertrochanteric line. So it has two bands. This is a stem, here is upper band, this is lower band. So this apex, which forms the stem, it is attached with the anterior inferior iliac spine here, and this portion, this is upper band, this is lower band. Upper band is thick, lower band is thick, and there is thin middle band. In between this, there is middle band also. There is middle band. This is from here to here, there is middle band. This is middle band. So upper band is thick, lower band is thick, middle band is thin. Apex attached to anterior inferior iliac spine. This is also known as ligament of Bigelow. Ligament of Bigelow. This is one of the strongest ligament in the body, and it prevents backward falling of the trunk. It holds from anterior side, this kind. And the ligament, this is iliofemoral ligament. Iliofemoral ligament, or ligament of the Bigelow. It is inverted Y in shape, and the ligament is pubofemoral ligament. Pubofemoral ligament, it has medial and attached with the iliopubic eminence. There is obturator crest here, and also some fibers arise from the obturator membrane. Here is obturator membrane which covers the obturator foramen. So this is pubofemoral ligament, and laterally it attached with this lower band of the ligament of Bigelow, and with this is attached with the intertrochanteric line. A gap here From this gap between iliofemoral and pubofemoral ligament, here a bursa comes out. This bursa is known as Schwarz bursa, because here iliacus and Schwarz tendon lies here. So this Schwarz bursa lies between the joint and ilioschwarz muscle tendon. So this is anterior attachment, that is iliofemoral and pubofemoral. Posteriorly, there is attachment of istiofemoral ligament. Istiofemoral ligament, here is greater trochanter, some fiber attached with the greater trochanter. This is attached the istium here. This is istiofemoral ligament. This ligament is istiofemoral ligament. It supports the joint from posterior side. This is istiofemoral ligament. So these are three ligaments here which give support. So it has 7 ligaments. First is transverse acetabular ligament, then acetabular labrum second, third is round ligament, fourth is capsular ligament, fifth is iliofemoral ligament, and sixth is pubofemoral ligament, seventh is istiofemoral ligament. So these are the type of the joint, articular surface and ligaments supporting the joint. This is first part of this hip joint. Thank you.